inhaled medications are. Yeah, absolutely. I'll add others. So in respiratory care, airway clearance, what nebulizers are, what inhaled medications are, and that there's antibiotic courses that target different things and have different timelines, different months that you take them. That's a lot of logistics. Digestive, whole host of things in there. What vitamins you have to take for what deficiencies. Enzymes I mentioned, that you have a specific dietary needs of high protein, calorie, and salt, and balancing electrolytes, all for lung function. That you're managing constipation and reflux, that's daily pain that is often overlooked. Monitoring diabetes onset, and caring for a G-tube and figuring out bolus speeds. Other care includes the CFTR modulator therapies, keeping up with trends in that, what ages and when you're eligible for them. That's a lot of information that you're trying to balance. That's just the baseline of the daily care for CF. So you all have had to become medical experts. Now we have to figure out how to translate all of that to a 10-year-old. That's a tall order. And that's just care. This says nothing about how to balance those things with your school, leisure time, friends, hobbies, extracurriculars, sports, dating. And it doesn't touch the logistics. Picking up and planning prescriptions for the week and month, cleaning equipment, that was mentioned, checking that it functions correctly, trusting and maintaining special education services, making sure you're getting them, utilizing and comparing insurance, finding programs to help cover costs, scheduling your routine appointments, coming prepared with questions, knowing if you're supposed to be fasting, if there's anything else you're supposed to bring or be ready for, contacting or knowing your cutoff point for when you should contact someone about illness, and communicating with school and employers. I'm going to be on the inpatient for a little while. And then you'll see me in appointments, kids' mental health, friendships, and adjustment to chronic illness. That's a lot to learn and balance independently. Let's also consider factors that might get in the way of developing self-advocacy skills, aside from how complex the job is in CF. One is just personal characteristics. Age, cognitive ability, and developmental level all play into a child's readiness to take over self-advocacy. Regarding developmental level, we know that that the adolescent period is marked by identity formation, a strong sense of self and interest, strong interest in normalcy and fitting in, and the feelings of invincibility. Those factors are going to impact teens' interest and motivation to participate in care at all. They may be in the middle of creating their sense of self. That may be shifting each year. They may be very absorbed in that sense of self, got no time to worry about this other CF thing, and they may see themselves as immortal right now. That's all normal. That was supposed to happen. Then you get to the older adolescents, and maybe they're growing out of that immortality, becoming a little more realistic and engaging more in CF care. Then they may lack some multi-step and follow-through skills for the long-term planning of CF. That's executive functioning. Executive functioning is in the front part of your brain. That develops well into your 20s. How's a 15-year-old going to break down those steps? Cognitive and developmental level vary widely, and it kind of determines your starting point for teaching self-advocacy. Other personal attributes influence self-advocacy. Personality and temperament in your kid, their motivation style. Are they intrinsically motivated? Do they need a little extra incentive on the outside to stay motivated on something? What's their communication style? Their feelings of control in their own lives? How comfortable they are questioning authority, so asking their doctors questions. How comfortable are they being seen in a less than ideal light, or sharing with their favorite doctor that they haven't been doing treatments? Then we have psychological vulnerabilities like anxiety in navigating healthcare, low mood related symptoms, or behavioral dysregulation and impulsivity. It may be that we have to treat those other things while or before we even consider self-advocacy. There's more than just personal characteristics. There's also social and cultural determinants of self-advocacy readiness or interests. Religion, race, ethnicity, social class, caregiver education, family values, ritual, and language all impact young patients' attitudes towards health and their ownership over their healthcare decisions. Culturally, what messages is a youth receiving from social media, school, family, and friends about illness or their illness, their healthcare, or just their lives in general? For example, what messages do they receive from family about expectations for personal responsibility? Don't think about CF. What parts of their lives do they already have autonomy in? Laundry? Getting dressed? School? Why do they have autonomy in those aspects? Why not? What messages are they receiving about work ethic and productivity? For example, what's their balance between working really hard, take no sick days, grind, work, get straight A's, whatever pressure they're putting on themselves or hearing from other people? How is that balanced with restoring, repairing the body? That's a cultural message, an Americanized concept. That's being heard by kids. What messages are they receiving about healthcare broadly? There are social implications about insurance, whether doctors are believable and medicine is effective. Kids are hearing those discussions from media and family and talking to each other about it. That impacts their interest in comfort and even engaging in healthcare, having anything to do with it. What messages are they receiving about hope for the future or control over their future? Kids with less expectation for their own high achieving potential are going to have less motivation to engage in care for their bodies for that future. All of that is impacted by their exposure to education, social class, language barriers. All of these factors, none of them are good, bad, or anywhere in between. They're not necessarily changeable or should be changed. They're just facts about a child's understanding about how the world works around them. Illness, taking sick days, taking care of themselves, navigating healthcare. They get that from friends, family, school, community, and just the society you're in. That makes self-advocacy development a more interesting puzzle. Any questions on this before I keep going? I feel like I gave a lot of information in one. Maybe I made this a scarier concept than it needed to be. Any questions? So those are the barriers and complexities to developing self-advocacy in CF. Let's consider some growth points, so our other objective, broad ideas that we can nudge to push towards self-advocacy. The first is education and exposure to information and topics of CF care, general body anatomy functioning, and their inner workings of healthcare systems. I blitz through complex information that someone needs to manage their own CF care. It'll take even longer to break that down and transmit it to a youth with CF. In fact, to help break down information by age group, I'll share out sort of transition checklists for, for CF patients and families to review. It kind of breaks down what skills and tasks a child can already complete, and it'll highlight for you what skills and topics they need to know more about. Let me show you an example of this checklist. Stop share. I can do screen share. Gotta find it. Let's go. There it is. Here's an example for ages 15 to 16. It breaks down whether we can do these things. Do I know my medications? Do I know warning signs when it's time to call the doctor? Do I help my parents remember my daily routines? Do I know I should stay away from other CF kiddos? Am I getting my own special accommodations at school? So this is just something to run through with your own kiddo. How much are they able to do this? Maybe they can fill it out on their own. Maybe you and other caregivers can fill it out for them too. Like, what do we think he or she can do? Cross-reference this with each other. There are transition checklists for ages, it's like 9 to 11, 12 to 14, 15 to 16, and 17 and up. So it's kind of broken down what skills we think they should have. that's a way to gauge what's our education level here? What's our engagement and exposure level here? Okay. All right, back to my PowerPoint. So, your CF team seeks to accomplish this educational component in your appointments. They're trying to teach you and educate you, and teach the child and educate the child. Your clinic may have child-friendly comics, pamphlets that explain CF phenomenon, how medications work in the body. Utilize those. I try to keep a book list of CF concepts or books that teach kids about their medications and CF phenomenon. I have a slide at the end of this that gives my books. I know I'm missing some, but they're just a smattering of them divided by age groups. So I'll share that out too. And it's just exposing kids to CF concepts. Your clinic may have team members like our child life specialists who provide age-appropriate education about CF in cool ways that are really engaging. There's a breakout room tonight about how to use slime to teach about sticky mucus. That's really important. That's medical play to understand the body. That's an education intervention. You could also try to expose your CFer to other kids with CF through peer-to-peer connections. I have a slide that reviews the program through this CF Foundation for kids that are 16 and up to connect to a mentor to talk about CF shared experiences. Your child is also welcome to engage social media related to CF. I do think this is also an opportunity to caution your teens about the accuracy of information that they obtain on the internet, because it can't be ensured that it has scientific integrity. Some is blatantly inaccurate. I think that's a perfect opportunity to teach kids how to research. I advise printing out any articles your kiddo reads or any social media clips, bringing them into the clinic and talking about them with your provider. Your provider is a scientist. They love talking about this stuff. Bring it in and help train your child how to consume information on the internet. There's other things that you can do to expose and educate your youth about healthcare management. Remember, self-advocacy is taught in part by example. It is challenging to learn how appointments are made, how prescriptions are called in, how insurance errors are resolved, because it's abstract, multi-step, and often invisible to the child. You may make those calls during the school day just to get them out of the way when you have time. Your child never sees it. You may have in your head a sequence of events that your child never hears, and so they lack exposure to it. Consider making visual supports or checklists so your child can see what you're doing and that you're teaching them the steps to problem solving. For example, what are all the steps to problem solving? We're gonna run out of enzymes next month. What are all the steps that you need in that? Feel free to share out. Any steps? I can fill them in.
Do you have refills?
Yep. You call into your CF coordinator and say, I need a refill place. That means knowing who your CF coordinator is, knowing how to contact them, knowing to follow up if the refill was placed, knowing if you needed a different enzyme. Maybe you should talk to your dietitian. There's a lot of providers involved. I think we can write down those literal steps that you're taking, cross them off as you're doing. Problem comes up, branch that off to a new set of solutions you're trying. Now you're taking these internal invisible processes and putting them into a clear, concrete visual that your child can see that it's linear, it's logical, and it has a solution. So I like the idea of making internal processes very overt. And then you can do the same thing with other visuals. For example, when there's insurance problems, draw an actual map of the insurance institution and the hospital institution. The bill gets thrown one way to the insurance institution. They have questions about it, deny it, send it back to the hospital institution. Your job as quarterback to help make sure those messages get back to the hospital providers. They answer it, you help send it back to the insurance. That helps make this process clear, overt. It's irritating, but now you're teaching your child what's happening in your head outside your body. Does that make sense?
Yes.
Okay, let's consider other broad advocacy skills we want to attack. Communication. So in my previous slide, I discussed like kids passively consuming information and education, observing, learning what they're taking in. Now, how do we get them doing the steps? I would practice having your child share about CF to their friends and classroom. Not only is this a good mental health practice, it helps you hear what they understand about CF, so you can fill in gaps. Teach about how all your healthcare entities communicate. Maybe your doctors use electronic messaging, phone. I don't know, maybe they use snail mail, in-person appointments. How does your insurance communicate? How can you contact people? Review every communication outlet you could possibly use. Prepare questions and comments before your appointments. Keep a list on your fridge or on your whiteboard. Put it on the list, be a common statement that you are using when problems arise in between, so that you're not just trying to think of comments or questions during very busy and overwhelming CF appointments. So now your child is practicing advocacy skills even in between appointments. Practice, 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 saying just a little bit during appointments. Maybe it's your child just talking about themselves. We got a hamster. I won the ball in my baseball game, or MVP ball, whatever. That's practicing talking to provider and treating them as a safe individual. Practice reading something out from your put it on the list problem list. Just read one thing. They don't even have to listen to the answer. Just practice reading it. Practice asking one follow-up question. In the entire 4-hour visit, your job is to get one follow-up question in. That's a small growth point. Practice saying, I don't understand. What's this for? And let me repeat that back. You tell me if I'm wrong. We should be practicing those phrases. Remember, self-advocacy is taught by example. That means you're going to model sharing information. You're going to model saying, I don't know, and what's this for? You're going to model not agreeing to things you know you're not going to do. CF care is really hard. I hear the things you guys are required to do. It's really, really tough. And if your kiddo hears you say, yeah, okay, yeah, we're definitely going to do that, but then you don't do that, it's going to show that communication is kind of like a one-way street. So you're going to communicate, you're going to model negotiation skills. Ooh, wow, that's going to be really hard this month. Can we make that a little bit smaller? What's our timeline? How soon do we need to get this done? Now you're negotiating and communicating openly with your provider, right? That's great modeling. Another growth point, this more has to do with the caregivers than the kiddo. So caregivers will have to allow your child to assume some responsibility as they mature. That's only accomplished by starting to take calculated risks. I would recommend having frequent, explicit conversations with your child about what you're responsible for and what they're responsible for. Write it down. This is a contract. This is what we're all agreeing to do. Make it clear, use a visual. This is your checklist of things to do. This is what time you have to do them by. If you're not done with it by the time I think you should be, I can nag you, or I can take away your phone. I am still your monitor and your supervisor. Kids have to learn first to be dependent on you, the little guys, then interdependent, highly supervised, then comes independent. So it's a staged process with every little part of CF care. Okay, let's focus on our last objective today, and that's to make a specific plan. We're not going to make kids responsible for all of their care navigation overnight. Instead, we're going to choose one skill at a time to teach, supervise, and then allow autonomy with. Youth are more apt to engage in activities that are in line with their own goals, that are convenient, easy to do, and have achievable, like quick bang results. I would encourage you not to pick the skill that frustrates them or bothers them the most. If enzymes are a daily argument and battle for you, don't pick autonomy in that one right now. There's a different one, like reciting their medications for their pharmacist and what they do at the next appointment, or scheduling appointments for themselves. Choose something else that's lower has lower emotional attachment. On this slide, I have an example of a worksheet that I'll send out that walks through kind of how to choose a skill and make a plan for building that. I'll then work through an example of how to complete this. Share my screen again. There it is. Okay. So on this little worksheet template, my first prompt is, what specific skill do I want my child to learn and take over? We're going to break it down one thing at a time. This parent wants their child to schedule routine follow-up appointments. That's it. Now let's weigh personal characteristics. What are personal strengths that are going to make taking over this skill pretty easy? This kiddo is super eager to show responsibility because he wants to take his driver's test. That's pretty good motivation. This parent has also noticed that this kiddo has taken over long-term project planning at school. He keeps them in his agenda, kind of makes a plan for them. Mom and dad don't have to check in on it as much. Okay, that's pretty cool. That means he's got some multi-step planning. What are some vulnerabilities or personal characteristics that are going to make this hard? This kiddo is generation, whatever this generation is, and hates talking on the phone. Only does text and electronic communication. Okay. This kiddo doesn't like thinking about CF when they're not actually doing CF stuff. So tries to kind of compartmentalize that a little bit. This parent has also noticed that this kiddo gets down on himself when teachers are disappointed in him. Maybe the parent's worried that he might be down on himself if the CF care team is disappointed by a mistake on this skill. Just things the parent is keeping in mind. Social and cultural factors that are playing in. Culturally, in this family, this kiddo knows that he can't go anywhere with friends until his treatments are done. That's something that this family set up years ago. So now we know we can kind of slip this into, this is part of your treatments in order to access the things you want. Yeah, we've already got that family value working. We also know that just last month, we added this kiddo to the electronic medical system under the guise that we wanted him more attached to his medical care. He didn't have any to-dos at that time. We just were starting to slide in that message last month. Okay, great. Other cultural characteristics that are going to work against us. Maybe this parent does all the appointments for the whole family. Haircut, restaurants, doctors, all of it. That means no one in the family has exposure on how to make appointments. Any other caregivers at all. That's the norm for this family. That's not bad, good, anywhere in between. It just is. Maybe this parent gets super flustered when they have to reschedule an appointment when they see a conflict. Now this parent is wondering whether they've sent accidental messages that rescheduling is bad and it upsets the clinic. That might make the child kind of nervous to call in for a reschedule. Just things we're keeping on our radar. All right, let's break this down. How are we going to make this goal happen? When are you going to discuss it and set goals? We're going to do it in November. We're going to bring up that this is our new goal for the child, and we're going to bring up if he can set 4 appointments, we're going to schedule his driver's test. So not only are you floating in, you have more stuff to do, we're floating in, and cool things are going to happen for you because we already knew his motivation for driving. How are we going to educate and expose your child to information about the skill? For this kiddo, we're going to call the clinic coordinator or talk to her at the next appointment in December and let her know that kiddo is going to be practicing this from now on. I'm hoping this will dispel worries about them being disappointed and extra fluster because that clinic coordinator is going to come in and go, wow, that's so cool. Can't wait to hear from you. And so we're going to try to normalize this process for him. We're going to find all the ways to contact the clinic that does not involve the phone because we know that we don't have to use the phone for this. Let's not even worry about that anxiety. Whatever. Let's talk about electronic messaging in person, in the phone, or email. Then we're going to teach other communication modalities, how to access the shared family Outlook calendar and cross-reference his online school calendar, because that's what you've been doing. He needs to know how to do that. He needs to know how to prep 2 or 3 Thursday options, or whenever your CF day is, not just one, so that when he contacts the CF coordinator, he's got some flexibility. We had to teach that communication style. Okay, now how are you going to practice and reinforce these steps? We are going to compose the message together the first time. Then we're going to together set push notifications on his phone for 2 days and 7 days after he sends the message to go back and check that the clinic coordinator messaged him back to confirm it. If he never goes back to check, he never knows. In that push notification, we're going to write, put this appointment on the family calendar, or else no one's going to know about it. All of these are skills he never learned in practice because this parent has been doing all the scheduling. Okay, let's teach it. We're going to agree that you're going to crawl before you walk, and I will give you up to 2 reminders to schedule each time. It still counts if you do it, even if you get those 2 reminders. We're also going to keep a cool chart on the fridge that has 4 boxes on it. And every time you successfully do these appointments, you're going to check off that box, and you are 1 step closer to scheduling your driver's test. The driver's test is not contingent on anything else, not grades, not being nice at home, anything. If he does these clinic appointments because that's what you said, he's going to a driver's test. He may not be ready for it and fail it. That's another issue. But he gets to do it if you guys said that this was the goal. So it's making the goal time-based. He has skills and growth on how to get there, and he definitely is going to get it, like you said, if he attains it. Okay? So that's an example of how to fill out this template for choosing 1 specific skill to grow 1 advocacy, how to use specific skills to grow 1 advocacy skill at a time. Let me go back. Okay. I had some other resources listed on the back slides. Just, I think I can send my slide deck out at the end of this. This is the peer-to-peer connect through the CF Foundation that I mentioned. You can be 16 or up. Adults can also speak to other adults or parents about how to teach self-advocacy. So it's signing up for a mentor about a topic. The Tennessee Department of Health also has parent-to-parent, not necessarily CF related, but related to having a child with a chronic illness or special need. Again, talking about self-advocacy or the shared experience of teaching up a kid with a disability. Here's my book resources. I will send these out. And this is a list of all the handouts that I'm hoping to share today. The last one is the Working with Your Child handbook. I love this one. I reference it all the time. It lists from 0 to adult age, the CF tasks, developmental milestones, and self-advocacy and communication steps that you're going to be growing over the child's CF lifetime. So I couldn't cover everything in that handbook, but just a smattering. Okay, references. So that is it for my lecture style format. Now I am very happy to take questions.
You did say you would send out that checklist. Yep. For the different age groups. Awesome. Mm-hmm.
Happy to discuss which skills you think you should be starting with, or personality characteristics or social characteristics that you'd like to talk through in general, not related to a specific child.
I'll ask a question. I don't know if you all can hear me. Kids are doing their best in the background, so that's why it's loud. But maybe how do you balance advocating for care as, you know, CF care has drastically changed and improved over the years, if you're talking to a younger child, you're kind of balancing maybe the reality of CF 10 years ago versus what CF is now, but kind of giving them that information about their condition without it being too overwhelming. If I have a 7-year-old, I'm not exactly ready to talk about plans, but that is the reality for some, for some people. So how do you balance kind of the appropriate level of information?
It depends on, like you said, age, maturity, developmental level. I think I would answer questions as they come up. So sometimes parents will get mortality questions fairly early. Am I going to die from this? I would answer those as honestly as you can. You could. I was just reading a very funny blog post about this from a CF parent. You could die from CF. You'd also die from a bear attack or a car crash or lightning strikes. Those all could happen. Luckily for us, CF treatments have advanced to where your life trajectory is probably more positive than it used to be. And that's why we do our treatments every day. And then we just move on. If there are follow-up questions like, but no, really, could I die from this? Maybe. But you don't know that. You don't know if they're going to die from a bear attack or from CF. You don't. And so you can answer honestly. Now, if there's questions about, why are they always talking about my liver? What does that have to do with CF? Answer it honestly. Your liver has to do with your CF. Talk to them about deficits that happen in other organs. Like, it's kind of like all over your body. And some kids need transplants. Not all. Answer follow-up questions as they come. Will I need a transplant? I don't know. You don't. We don't know that. Maybe your provider has given you additional information about the likelihood of transplant. Well, Dr. X has let us know that we need to be doing a few more labs and checking this more frequently. That means it could happen. Answer questions on transplant. Will it hurt? Maybe. Will I recover and get better? Probably. That's the extent that you know. Right? So I think answer the questions as accurately as you can when they come.
That's helpful.
Other questions?
I know we've encountered in our clinic sometimes teenage boys specifically that sometimes go through this hump where they just, even though they have the education and they know they've gotten all the medication, list, know why they're supposed to do everything. We talk about treatment burden, it's a real thing. So sometimes with that age and they'd rather play Xbox or so on and so forth. And we've tried the little gift cards and incentives. Is there any magic that you have to further incentivize them to be an active participant in their care?
No, I don't have anything magic. Good question. I wish I did. So lack of education, right? We know how to do that one. Lack of exposure, we can do that one. Communication skills need to be boosted. Got it. Lack of interest. Oh, that's that hump that you're describing, and it comes with that time period where we're immortal, we're invincible. I don't have CF. I know I have CF, but do I only have it a little bit? That's an awesome adolescent phase. And usually when I'm talking with kiddos like that, I try to validate, yes, you should be driving fast cars, skipping classes a couple of times without telling people. You should be doing these things, and that's awesome. You also have CF. So importantly, I didn't say but you have CF, so your life's a drag. You're doing these things, you're driving fast cars and trying funny things, and you have CF. So we can make a plan for helping you grow CF in the smallest step possible. It's the same thing that I would do for profound depression. there is no interest to do anything. So how do I break down CF care to the smallest microbe possible? Is it next time I come into the appointment, I can recite all my medications? And then literally every provider comes into the office for a high five because it's the greatest thing in the world, right? Is it that I call in one prescription, and even if I don't get through to the pharmacy because they didn't pick up the first time and I don't try again, dadgummit, I tried. And then all the providers go nuts. I tried to break down just the smallest thing you can do and add in as many environmental supports as possible. I have had kids put enzyme reminders on their lizard cage because they never forget to feed the lizard, but they always forget to take their own enzymes. Put the enzyme reminder on the lizard thing. Now it's a more attainable skill. So those are things that your mental health coordinator is very happy, can creatively think of other things, or your whole team, like, what are they really good at? Real good at Xbox. How do we tape the enzyme bottle to the remote? Right? It sounds ridiculous, but these are things we can do. I've had kids put their enzyme bottles in the cereal box. So they have to like get around this plastic thing in there. What's that, your enzymes? Those are environmental supports to make this silly, ridiculous. I've had people I've suggested putting child locks on the refrigerator. Not that a teen can't figure out, that's not the purpose. It's for them to go to the fridge and go, why is there a child lock? Oh, right, enzymes. And then they open it up and get to it. Those are just kind of environmental nudges and supports. Now, if it's a complete lack of interest of, I'm not doing this no matter what silly games you play. So, right, that's kind of accidental forgetting environmental supports. For lack of interest and flippant, like, I'm not doing this. That's when we start to parent more aggressively. Why does that child have access to Xbox? I think we should start setting up contingencies. We can earn Xbox time with every pill that gets taken every day. Maybe they need a lot of support on putting out their pill box, taking out, maybe a parent has to watch them take that pill. But the password to the internet is their access to the internet password every day is going to depend on their compliance with treatments. That child is not ready for self-advocacy. They still need a lot more dependence training while they're going through this cool adolescent phase.
Thank you so much.
Mm-hmm. Other questions? I feel like I am out of time, but I'm not sure.
Yeah, you're out.
I'm out of time. Okay. Well, thank you all for joining me. I will see you all at the plenary.